How are you doing today?
I've been having some back pains.
Really? Low back or upper?
Pretty much everywhere.
Everywhere?
On the back side.
Okay. I guess being pregnant kind of does that to you, huh?
Yep.
All right. Well, why don't I have you come up here and let's just get behind you and take a look here. Yeah, it's probably more compressed than anything. Yeah, a little bit there. Let's bring you over here to this wall. Have you put your back right against there. Okay. Have you pull your elbows in tight together, then just relax and lean forward. Okay, good. Bend your knees. Oh yeah, and bend them some more. Okay, great. Sound like we were moving quite a few segments there. That's the nice thing about this table. You can lay on your belly. You probably don't get a chance to do that at home.
Nope.
Yeah. Are you?
That feels good.
Okay, good. So you're in your third trimester, right?
Yeah.
Okay, good. Now, knees straight, lift that leg as high as you can. That works. Now down, then the other one. Great. How's the low back doing today?
I've had some sciatic pain.
Which leg?
Kind of both.
Kind of both. Okay.
Maybe the right a little bit more.
You still having it right now, or did it come and go?
It comes and goes.
Okay. I think we just need to loosen that tailbone up. Okay. Cross the other way. Good. Uncross. Great. Now, lift that leg as high as you can. That's a little bit better. That one? Yeah, that looks good. Doing okay? Okay, I'm going to bring that over. That's usually a stress area. Oh, that's not too bad. I think we need to get you over on your back. Any headaches or arm pain, neck pains?
Sometimes after I sleep at night, my hands will be numb.
Just the hands?
Just the hands.
Okay.
And it's actually weird because it's like these 3 fingers on both hands.
Oh, really? Okay. Well. Okay, good. Now I'm going to come to up here. Your atlas, which is that top vertebrae, seems to be out. There we go. Good. You got that. Now, let's check these shoulders. What I need you to do, Melissa, is to lock your elbow, keep the hand loose, point the thumb, push above your head.
Oh, that hurts my elbow.
Okay. In here?
On the outside.
Out here?
Yeah.
Right. Oh, okay. Well, that'd be we call it the radial head. There we go. We got that taken care of. You're outlining a certain nerve that runs down your arm too. That's usually pinched up higher. We don't know, but okay. Now point that. Lock your elbow. Elbow okay. Push above your head. All right.
Oh, that hurt.
That's hurting. Okay. Okay. Oh yeah, there we go.
Mm-hmm.
Now let's scoot you down a little bit. Okay. There we go. Good. Grab on with both arms. Pull yourself up. How are you feeling?
Feels better.
Wonderful.